few ideas. I apologize for taking so much time, but obviously we're passionate about it, and that's what we're working on.
No, thank you for your work on that. And for the audience and everybody else on the panel, we have a colleague, Senator Patty Ritchie from the North Country, who sponsored a bill that would require 90 days of treatment, and the three of us are co-sponsors on that bill. So, you know, we're probably one of the things that we've heard most about, a reasonable amount of time for somebody to get treatment. And, hopefully we can move that bill in the Senate. And again, I've said this, and I know my colleagues have it, this is such a nonpartisan issue. The Assembly should take it up. I would encourage my colleague from the Assembly to help us push that on that side of the building, and hopefully the governor would sign that. So D.A. McBride and then Judge Palella, and then we're going to my friends from law enforcement. I'm sorry.
And Judge, I don't mean to jump in front of you. One other issue that we have that's going on that's very important is the hypodermics in New York State are still illegal. But there's a provision that if you obtain them lawfully, then in fact that they're lawful. But there's no way for law enforcement to prove that. It's creating a big problem in law enforcement about whether or not there's legal or illegal hypodermic instruments. If the state wants
to have a card, right, John?
They should.
Well, they don't all.
From a syringe exchange program. But they're also legal to buy from a pharmacy.
Exactly. And when you buy them from a pharmacy, my understanding, and John, you correct me if I'm wrong, you don't get a card, and there's no way for them to know. Now, that being said, there seems to be a move in New York State to legalize that. If that's going to happen, it's going to make my job, the sheriff's job, and every law enforcement officer's job a lot easier. If we're either going to say that it's legal or we're going to say that it's illegal. If we legalize it, then it's easier for people like John to get needles to people who need them. If we decriminalize it, we can't give a mixed message, because it's not fair to the officers who are out there on the streets and trying to figure out who has them legally and who has them illegally. But now, if whatever the state decides to do, the last issue is, and I'll hand the mic over, is there's a lot of needles on the streets, not only in Shenango County, but in Broome County and throughout New York State because of this problem. What I would like to see is not only that we resolve the issue about who can have them legally, but make it a more serious offense to dispose of them illegally. Not only are you creating a health hazard for everyone in your community, you're putting your kids at risk in parks, parking areas, and every other place. We need to make sure that while we're fixing the heroin problem, we also fix the needle problem that's occurring in all the communities in our area.
Sure. I'm going to politely suggest that if people were not being prosecuted for possession of them, they probably wouldn't be tossing them away.
No, maybe you're right. Maybe you're right, and if that's the case, then we'll solve that problem. But there is a problem with needles in our community.
Thank you. We are about 5 minutes before 6 o'clock, so I'm going to ask Judge Palella to speak about the drug court system in Broome County. We'll finish up with our friends in law enforcement, and then everybody will be on their way. Judge Palella.
Thank you, Senator. I've been involved in the criminal justice system for 35 years. I've been a prosecutor, defense attorney, and for the last 11 years, a judge. And I've had the honor and privilege of presiding over the drug treatment court for the last 11 years, and for the last year, presiding over the Veterans Treatment Court program as well. The goal of those programs is to break the vicious cycle of addiction. We've talked about it a little bit here today, where someone uses, they get arrested, they go to jail. They get out of jail, they do it all over again, and keep doing it until a couple things happen. Either they're in prison for a very long time, or they're dead from an overdose. And so what drug court tries to do is, with the cooperation of our partners in the community, to try and break that vicious cycle of addiction by treating the person, the entire person. We deal with their health needs, we deal with their educational needs, we deal with their employment needs, and we deal with their addiction. I have partners such as ACBC, New Horizons, the YMCA, the YWCA, the Salvation Army, the district attorney, the halfway house, the public defender, private attorneys such as Paul Battisti, who's here today, who really want to look at the bigger picture and try and help people who are involved in the criminal justice system. And what we do is I have that whole team of professionals helping me, assisting the court in trying to treat the person and make them whole again, and take them from being someone who's in jail, costing the taxpayers a lot of money, to making them a productive citizen. And over the years, I've been able to look into the eyes of my participants, and I've seen the tremendous grip that a drug such as heroin has on a person. You can see it in their eyes. I can see it on their face, the despair, the lack of hope, the giving up, just wanting to survive for another day. But I've also seen the face of recovery. I've seen someone who has been able to complete our program, and for the most part, our program will last 1.5 to 2.5 years. It's not an easy program. It's a program where I have to balance the needs of the participant with the rule of law, and I have to make sure that they're held accountable and that they are responsible. But by doing that, we really can make a difference in their life. And I walk to work every day. And recently I had a car pull up on Riverside Drive, and somebody got out. And, first as a judge, you're always, what's going on? But it was a graduate of my program, and I could just see on her face hope, the happiness. She's got her kids back. She's working. She's doing something in her life. She has hopes and dreams. So our program is one of hope, not despair. It's one of life, not death. And really, we're talking about life and death. We're not talking about criminal cases. And it's the most rewarding work I've done in the criminal justice system, but at the same time, it's the most difficult work I've done. But I think it is an example when we come together as a community, when we take hardworking professionals in the treatment along with the professionals in the criminal justice system and combine them and work together to help these people that are in our program, it really can make a difference, and I've seen it.
Well, on behalf of the community, I thank you for your ongoing commitment. Thank you. To my friends in law enforcement, Captain, maybe we'll start with you and we'll go down the line. I think in terms of maybe talk about the things that you're seeing from a law enforcement perspective, and then quite frankly, I'd like to know where the legislature can be helpful from a law enforcement perspective.
First of all, thank you, Senator, for holding the hearings here, or the round table here, and thank you to everybody on the panel. All the main points have been touched. From a law enforcement perspective, this is taxing our resources unbelievably. Everything from low-level petty crimes right up through, I think I can speak for all of us, anytime we get a report of a robbery, almost the first instinct is, well, what heroin addict is it? I think from a law enforcement perspective, we're coming to realize that addiction is a disease. I think like you, I think we, years ago, we all thought we were the solution. Now I can absolutely say this is not a law enforcement problem. We deal with some of the problems related to it, but this is absolutely a community problem. Where this is coming from, and as you know, I spent 15 years with the State Police Community Narcotics Enforcement Team, and one of the things that I had the people who worked for me do is interview anybody we arrested or any informants that had any sort of an addiction, and almost to a person, they've all started with pills. There are a few who started out with marijuana and other drugs and progressed up through, but most of them and many of them were legitimate pill users who, before they even realized that they were addicted to the drug. And also, as many of you know who've been to panels before, I personally have dealt with this. My niece was an addict who is now 2 years recovered. But I spent 15 years in charge of a narcotics unit, and for a long time I didn't know my niece was addicted. I didn't recognize the signs. I didn't ask myself the hard questions. And so what I would put out is prevention and awareness are the key critical components of this, and certainly treatment is the third part of that. And just to dispel any myths in case they're out there, from a law enforcement perspective, we don't target users, ever. We would eat up our resources in a matter of really minutes. If I think all of us could walk out today and target 25 or 30 users without even thinking about it. We focus solely on dealers and primarily on dealers who are profiteers looking to make money off of it. There are certainly people who are dealing out there to support their habit. We do arrest them. They are committing crimes, and we do arrest them. But I just wanted to make sure that that's known, that it's really not even a consideration of ours to go out and look for people who are actively using. And generally when that occurs or people are arrested for possession, it's one of two things. It's either a patrolman who has come across the drugs while they were in the course of their duties one way or another, or the arrest is the result of possession with intent to sell, but we've targeted them as dealers.
Thank you, Captain. Chief Zukoski, thank you for being here with us today.
Thank you, Senator. I'm glad you left us the last because you didn't have much time, and nobody could better represent us than you, knowing what our needs are.
Thank you.
Just coming from the front lines and working closely with you. I can't agree more with the captain. You know from our task force we don't target users. The few times we do, it's to get to the dealer themselves, and that's not too often. Patrolmen have their jobs that they have to do. From what you can do from us, you know, I hear Ray's figures, and he said 64 in the county. You know, we buy our own Suboxone, and I think our stats are a little separate from yours. In the city alone, in the 14 to 15, we administered 78, just the police department. And we're funding that ourselves, so a little help there. It's not a huge amount of money. The resources, as the captain spoke about, I don't have to tell you all the manpower we have addressed to this and, you know, what we're doing. And as far as taking some of the burden off the local community, you know, some money for overtime, because everybody'd ask you for cops, and you don't know what they're doing. You know, can I have this position, but maybe, you know, some funding where it's a narcotics investigation, where we can prove this is what the money's being used for, because I don't have to tell you about funded positions and how they get used and things like that. So, you know, just so everybody knows, you know, I'm not going to bore you with any figures, but from the state registry, opiate deaths in Broome County, there was 31 of them in 2014. And in 2015, there was 27, 12 of them being in the city of Binghamton. We responded last year to 101 overdoses that the police department did, and sometimes the fire department goes without us. So that's just what we're dealing with. But, you know, we can't arrest our way out of this, you know that, and we can't incarcerate our way out of this. This is a community problem, and I couldn't agree more with the captain that we're just a little part of the solution at the bottom. Everybody in this room is a solution. And I'll just close up with, almost embarrassing to say, a good friend's son just recently had a problem. And they were at their wits' end, and I said, have him arrested. And, you know, turn him over to Judge Puello, because I have a lot of respect for him and his program. He saved a lot of people. This is a kid, his parents have a lot of money, and they're at their wits' end. And he stole his father's credit card, ran up thousands and thousands of dollars. His grandfather didn't even know it, stole everything out of the house. And I said, you know, it's unfortunate, that's where we're at. You know, they're calling me and calling my wife and have him arrested. And let Judge Puello have a shot at him. So I think we need funding, you know, any way you can help his program or any of these other programs here. You know, that's how we're going to get out of this situation.
Thank you, Chief. Captain?
Thank you very much. Thank you, Chief. This one works just fine. Thank you, Sheriff. You know, I've heard the statement here several times today that we can't arrest our way out of this problem. However, I want to make it perfectly clear that law enforcement has a clear job to do, and that is to arrest the drug dealers, as I think Captain Gary already referred to. So that is our job, and we're going to continue to do that. And I'm proud of the numbers and the arrests that our drug task force have done in conjunction with the Binghamton Police Department, as well as the Johnson City Police Department and the Endicott Police Department. They work very, very hard, tirelessly, to arrest the drug dealers in this community. With that being said, I also am proud of the job that the law enforcement community has done over the last couple of years with turning around the, you know, Penny spoke about the stigma, and turning around the stigma that the law enforcement community has. The law enforcement community can be a very jaded group of people, and they've turned that around as far as awareness, as far as being on the front lines and starting the Narcan program. saving many, many lives. The programs that we have in our correctional facility. I think that law enforcement has done a very good job, and I think that in recent years they've had the opinion where they could arrest their way out of it. And with that being said, I think that they've turned it around where we've become much more aware of the problem, much more sensitive to the problem. So I think that the law enforcement community is doing a very good job there. You know, a few of the other programs that we've implemented is we're working with UHS as well as Fairview Recovery, trying to help the addicts to get to the beds available in our community here locally. We have, I think somebody had touched on this earlier, but we have the drop-off boxes. If I could speak on behalf of Sheriff Harder, we try very, very hard to implement these new programs and to do everything that we possibly can to help the community. So it's very multifaceted, I think, from a law enforcement perspective. We're involved in a lot of different ways, whether it's through the correctional facility, whether it's arresting the drug dealer, or whether it's assisting the addict to get to the bed at the ACC here locally in the city of Binghamton. So I just want to make that clear that, you know, law enforcement has a pretty big lift. While it's probably not as big as the treatment and the treatment options and some of the struggles that these folks deal with, you know, we're doing the best that we can too.
Well, I think yep. I think everybody would agree that it's certainly a very important tenet in dealing with the issue. And Penny, I think I recall having one of our first conversations about law enforcement having a jaded view about this particular issue.
Can I say something about that a minute? Is that all right?
Yes, please.
My son's teacher called and told me that she had witnessed someone overdosing, and she had called for the police. And when they came, they were able to administer Narcan and were able to revive the young man. Unfortunately, the two law enforcement officers who cared for him at that time turned to each other in front of her and said, "Yippee, saved another junkie today." That was a pretty devastating thing to hear. And it was pretty much how I felt about law enforcement officers, honestly. Probably one of the best things that happened for me was that I spoke about that at a BOAC meeting, and Senator Akshar, who was undersheriff at the time, stopped the meeting and apologized for all of his peers. I have to say that when my son overdosed, the people that came from EMS and the police department worked tirelessly for an hour to try to bring him back. So yes, we've come a long, long way, I think, as far as stigma in our law enforcement. But we have a ways to go.
Absolutely.
Overall, one of the other things that I have a deep concern about is Narcan and where Narcan is available. I think Narcan should be available in our schools. I think Narcan should be available at any living facility where someone is coming after jail or treatment. Because it's a misperception to think that because it's there, people are going to use. If they're going to use, they're going to use, and we should be able to save their lives if we can. And thank you for all the times that you have.
Thank you, Penny, for pointing that out.
Last but not least, my very good friend from Tioga County, Sheriff Howard.
Thank you, Senator. I'll make it really quick. I'm just shy of my 40 years with the Sheriff's Office, and I've seen this wave come through every so often. And Captain Gary will agree with me, the methamphetamine problem that came up in about the 2002, 3, 4 was huge. And during that time, I was asked to go to Washington and testify before the House Science Committee to get some laws changed. Then I came back, I went to Albany, and I testified there to a task force. We got some laws changed. Senator O'Meara was standing next to me down in Elmira when Governor Pataki signed some new laws in. So now you go to the drugstore to get Sudafed, and you have to show your license, and everything's tracked that way. And that was cutting the head off the snake. It's coming back, and that's a different problem that we're dealing with now. I agree with the captain when he said that this is a community problem. We can't solve this like we did with the methamphetamine by getting some laws changed and having some control. I have a relatively small jail. Probably half of my inmates have some type of addiction. It's a huge strain, not just on my corrections officers, but my medical staff and the community, because they're the ones that pay for the addiction problems when they go into detox and when we have to get them into the hospital for infections and all those other issues that come with it. It is a community problem. There doesn't, a day doesn't go by that we have a tip line on my website, anonymous tip line, that we don't get a tip about some drug use or drugs being sold. And I agree with the chief and the captains. We're not out to get the users. We need to cut the head off that snake, and those are the dealers. And it's time consuming and it's very expensive. And just one short story, my son lives, is a deputy sheriff in Oregon. And when he was growing up, he said, what would you do if you caught me with drugs? I said, I'd arrest you and send you to jail. And that has changed. Now I have a grandson who asked me the same thing, and I told him, I'd take the drugs from you and get you some help.
Yep.
That's all I have.
Thank you, Sheriff.
Senator.
Senator, if I could just add one suggestion for you to think about with the legislature. And the chief and captain and sheriff have all kind of touched on it in different ways. But when the methamphetamine epidemic started, one of the pieces of legislation that went in was that law enforcement agencies had to send a message to Albany indicating where a lab was, and it gave us a tracking of what was occurring, where the trends were, where the labs were coming, and what type they were. And one of the things that I've found in dealing with this over the last year or so is that we all have our own statistics with regard to overdoses and when Narcan was used and when it wasn't. And I know there are some things reported to the state, but I would just suggest maybe looking into all law enforcement, fire departments, EMS, and healthcare personnel all being required when there is an overdose of any kind, not just an opiate, but any overdose, that goes into some central database where we get real numbers that we can track what drugs are trending at that point and what is causing overdoses.
Thank you, Captain. Well, we have clearly run over our time. Superintendent Gill, again, thank you for your hospitality. I'm sorry we went over 15 minutes. I want to thank everybody on this panel for fighting the good fight on the front line. I know that it's a huge lift, but it's clear to me that there are many people in this community who care. And, you know, I think the biggest thing, and I said it when we started, is that, you know, we as leaders need to ensure that we're setting personality and we're setting political differences aside and we're moving together as one. I think that's the most important thing, because if we're not doing that, I think the only people we're harming are the people who so desperately need our help. So I would encourage everybody to, you know, stay together, as tough as it may be. We all have ideas and plans. None are more important than the next. Just important that we move forward together as a team. So with that said, Senator Ort, do you have some closing remarks?
Not really. I mean, it's hard to, you know, after a great discussion and a great panel here that you put together, I want to thank everyone for being here as well. And I wanted to sort of clarify, you know, earlier I said you hear sort of similar themes, but that doesn't mean you don't hear new ideas or new, very worthy suggestions from each discussion. And this is no different. And I can assure you that I'm going to be having, I know Senator Amador was not here today. Senator Amador, along with being a co-chair of the Heroin Task Force, is also the chairman of the OASAS subcommittee. And I know he would be very interested to hear some of the issues, because that is a little bit more nuanced or specific than I've heard after 6 or 7 hearings. I will be having a phone call with OASAS probably in the next week or two, much to their chagrin, because they generally don't like to hear from me. But that's okay. So, you know, we heard some different suggestions, And like I said, the plan is this session, now that we're past the budget, you're going to see some a comprehensive legislative reform package that's going to include a lot of things. I'm not going to be disingenuous. It's probably not going to include everything that everybody thinks should happen. But I think it's going to include a lot of things that we all can agree are good things. Does that mean there won't be still challenges and battles? I think you heard from the law enforcement. This is kind of an insidious epidemic. It sort of moves. You know, just when you do this, you do I stop, and then all of a sudden heroin pops up. You know, you try, everything you try to do, it sort of adapts a little bit. So we'll keep fighting the fight and try to, I think the best solutions come from the bottom up. You know, they certainly do not start in Washington or in Albany, but you already know that. They start on the ground level. They start with, in places just like this, they start with everybody here who's on the front lines. They start with people who've lost loved ones and who have the courage to turn that into something positive. They start with people who are 9 years sober, who are leading the fight and setting good examples. It's not these three people in the middle here. It's everyone else up on this dais. So I want to thank you for what you're doing. You help us be better legislators. You're going to help lead the reform efforts. And when we get some positive reforms, and every time we save another life, it's because of the people up on this stage, and it's not because of anybody in the middle here. It's all of you. So thank you for what you're doing.
Thank you. Thank you, Senator Orr. Senator O'Meara.
Yes, thank you, Fred, for putting this together. Thank all of you for coming out and sitting in and listening and showing your concern of what's going on in our communities. It's vital that we all work together, as we've heard from all of our panelists here, and certainly thank you to all of our panelists for taking your time out and expressing your ideas to this. As Sheriff Howard said, back when I was in the State Assembly in 2005, and we still had Governor Pataki, we pushed for, with Sheriff Howard's leadership, a lot of changes under the methamphetamine laws. And we had a similar task force to this that I was on in the Assembly going around the state that led to a lot of the positive changes that came out of it. Methamphetamine still continues to be a problem. And no matter what package of legislation we come out of this year with this, heroin will continue to be a problem. We've just got to get a better grasp of it. You know, I've been on this committee now in the Senate, this task force in the Senate for 3 or 4 years. In 2014, we did rounds of hearings across the state. Participated in one in Elmira, in my district that we had, and that led to a package of legislation that it's a constant progression, I guess is my point, that we're working on, and we'll always be working to perfect this, the access to treatment, the availability of treatment, and just to deal with this real problem that we have in our society. But thank you all for being a part of the solution here.
Thank you, Senator O'Meara. So, Ruth, we'll make it a point, my staff and I, to follow up with you and the others associated with treatment in terms of regulatory reform, and then I'm going to get that information back to Senator Ort and the other co-chairs. So hopefully we can put our heads together and move on something like that. Again, I would encourage everybody in the audience, if you want to submit written testimony, to please do so before you leave. To everybody who's streaming this live at home, please visit my website, akshar.nysenate.gov, and we'll accept your written testimony there as well. Again, thank you all on the panel for participating. I pledged accessibility when I ran for the New York State Senate. And I want everyone to know, not only on this panel, people who are watching at home, people in this community, that I meant what I said. My door is open to your ideas, your suggestions, your issues, and where I can be helpful, I need to know that, and I encourage everybody to come knocking, because I stand ready to fight the good fight for you, and I have a remarkable staff that I have to thank for putting this on. Please, a round of applause. There was so much more than simply setting up tables and putting some nice red skirting around the front of it. So I have them to thank for making this happen, and it was a huge lift, and I'm eternally grateful to each of you who made that happen. And to the men in the back of the room in uniform, thank you very much for providing security. We appreciate it very much. So again, thank you all for participating and coming out, and I wish you all a blessed evening.
Thank you.